It's Saturday. I figured I'd try to be a little more laid back and relaxed today. But even on a Saturday, we cannot escape viruses. This is Dr. Khadisha, your board-certified emergency medicine physician. My emergency care in both the emergency room and in my concierge practice helps make people feel better, be safer, and be better prepared should they have to face an emergent situation. Hi, Dr. Carol. Thanks for taking your time out to check in with me on the way to your event. Dr. Carol is going to be at the Bowie Honey Baked Ham at 5:30, 6900 Laurel Bowie Road, talking about health and wellness and meditation in a time of madness. It's going to be fun. It's going to be relaxing. Okay, guys, so I guess I will get started. Hopefully, you guys who come in late, you can check me on the replay. Again, I am Dr. Khadisha. I'm your board-certified emergency medicine physician and entertainment industry mobile MD. My emergency care, my concierge care, and medical advice helps people feel better, be safer, and be better prepared if or when they face an emergent situation. Hi, John. Thank you for checking in with me. Hi, David. I think that's Dr. David Wilson, I believe. Thank you guys for checking in with me. I just want to take a few minutes of your time on this Saturday afternoon. I am, even though it's a Saturday, it's a nice, easy afternoon. Viruses are everywhere. People are still going into the emergency room as we speak for the sniffles, for the coughing, muscle aches, and sore throats. And they're finding out that their strep tests, the tests for strep throat, are negative. Their flu test is negative. Hi, Dr. Dietrich. Thank you for coming in. Thank you, Dr. Salika. Thank you so much for taking time out of your busy schedule, everybody, for coming in. And so, yeah, I'm seeing, even at this very moment, people are being presented in ERs all over the country with negative flu and strep test results. And they're just like, well, what is it? And the doctor is telling them that they have a viral respiratory infection. And a lot of patients are still asking these doctors for antibiotics, making my fellow doctors uncomfortable and telling them it's just a virus, antibiotics won't work, and making doctors kind of feel a little uncomfortable about discharging a patient with no antibiotics. And unfortunately, it might be after waiting in the ER for a few hours. So for those doctors that don't have time to tell you why they're sending you away with no medication, even though you're having all these body aches, sore throat, cough, earache, even diarrhea, some of you, I want to help those docs out and help you guys out. So what are viruses? Viruses are the germs, and they're not like bacteria, which are, whole cells that function on their own. Viruses are, they're bits of protein. They're like genetic material, and they cause symptoms similar to bacterial infections, but they're completely different. They are hijackers of our cells. They invade our living normal cells, and they cause our cells to multiply and produce other viruses like themselves. And this can damage, change, even kill some of our cells, and it makes us sick. And different viruses attack certain cells. So, there are viruses that cause hepatitis. There are viruses that cause pneumonia, and there are viruses that cause, like blood infections, like sepsis. You can be septic from a viral infection. So viruses are, while they don't even, while they need our cells to survive and to do what they do, they are very powerful, and they can cause a wide range of symptoms, like those of the common cold, meaning like a sore throat, bronchitis, that cough that everybody seems to have right now. It can cause pneumonia, diarrhea. It can cause pink eye, just a plain fever. There are even viral bladder infections. And some viruses can even attack the brain and spinal cord. And, the illnesses, the symptoms can be mild to severe. And serious illnesses are typically less common in those of us with normal immune systems. But people with weakened immune systems or existing cardiac or respiratory disease can develop those severe illnesses. And what are some of those classes of viruses that cause flu-like symptoms? Those symptoms that drive you to the ER with your body aches, fever, sore throat, earache, sometimes nausea, vomiting, and diarrhea, but you get a negative flu. There are multiple viruses that cause flu-like illnesses. It's not just the flu. I mean, there's para-influenza, there's the adenoviruses, the rhinoviruses, the coronaviruses. And in each of those classes, there are multiple other viruses underneath that can cause symptoms. And they're usually spread from one infected person to another through close personal contact, such as touching or shaking hands. And that's why once you shake someone's hand, if there's no way around it, you should wash your hands quickly before you touch your face. They can be spread by, coughing, or sneezing. So when someone says, "Oh, it's just a cough," don't just blow it off and take it, just be like, "Oh, it's just, because it's a dry cough that you've only had 2 weeks." I don't want a dry cough that lasts 2 weeks either. If they're not polite enough to cover their mouth, you cover your mouth. I do it. I mean, I feel a little funny doing it, but if they don't cover their mouth and they're coughing and sneezing, I'll cover mine. And I'm told, like, if you can stay at least 6 feet away from a person, you're relatively safe. Also, touching an object or a surface that has viruses on it, and then touching your mouth, your nose, your eyes, or something before washing your hands. That's how you get the viruses. And the viruses can even be spread through stool. So if you have a sick baby and you're changing diapers, you can also get it that way. And that's how, you might have respiratory symptoms and your baby has diarrhea. Because viruses are very powerful and they can cause all kinds of symptoms. And that's just what I'm trying to drive home. So how do you prevent it? Well, be quick. So again, wash your hands, often with soap and water. That sanitizer stuff is only if soap and water is not available. I'm seeing sanitizer in the public bathrooms or retail bathrooms, bathrooms at various places of work with sanitizer right next to the soap and water. No, that's only if the soap and water is not available. Sanitizer is not an equal opportunity, an alternative to soap and water. If there's soap and water, use soap and water. Only use sanitizer if it's not available. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. And if you do get sick, stay home. Cover your mouth and nose when sneezing and coughing. Thank you, Dr. Carol. Thank you, Dr. Dietrich. Please Soap and water is up here. Sanitizer is down here. Okay? And you know that coated feeling your hands have after using sanitizer? You know that, yeah, the bacteria might have been killed or disabled, but that stuff is still there on your hands. So stay home when you're sick, cover your mouth and nose, refrain from kissing other people, and again, frequent hand washing is especially important, like in child care settings, healthcare facilities. That's why we're always washing our hands, and and wash your children's hands too. Just because they're cute and small and precious and, they're your children, they still have germs. They can still get you sick and they can still get other people sick. I had to stop a lady who brought her little 2-year-old grandson from leaving the bathroom after he had diarrhea. She didn't wash his hands or hers. It's like she didn't think he had germs. It's like, yeah, even the little ones can have germs. So that's all I wanted to pass on to you guys. Viruses are not bacteria. Antibiotics are not going to rid you of a viral infection, and that can be why people are also coming into the ER likely as we speak with symptoms that have lasted for 1 week, 2 week, 3 weeks, and they've had a Z-Pack already, which is the Zithromax pack, like 3-day pack or 5-day pack. That's a very popular antibiotic. They might have had that and they still have symptoms, and that could be because what's causing their symptoms is a virus. So please be kind to the doctors, listen to them. They have years of experience with viruses and bacteria, and treating those infections. And if they say that it's a viral illness, just give it a chance, give it a couple days or more, because it might take more for the virus to resolve, because the virus is going to resolve on its own. Yes, bacteria respond to antibiotics, and they should start to dissipate by the time you finish that course of antibiotics. And again, finish the course of antibiotics. But if your symptoms go on for a week or two after finishing antibiotics, it's probably because you have a virus, and it's going to run its own course. All you can do is take medication or do home remedies to treat the symptoms. If you're congested, inhale steam every few hours to help clear your nasal passages and hopefully, help get your sinuses ready to drain. Sleep with a humidifier in your room to help with the congestion. You can, if you don't have, high blood pressure, you can take, Sudafed or cold medicines with pseudoephedrine or phenylephrine in them. Those are both decongestants. You can take things for the symptoms if you have a virus, but antibiotics are not going to work. So please stop. I don't know how you say it. The word escapes me, but can you please stop pushing the docs to give you antibiotics when they think you have a viral infection, because most likely it's not going to work, and you might be exposing yourself to the adverse effects of the antibiotics unnecessarily. Like amoxicillin that we prescribe often for ear infections or sinus infections, that can give you diarrhea. Zithromax can give you diarrhea also. Dr. Carol gets good question. They usually say the cold mist humidifier is better. That's what I've been told. Dr. Ajax Madrid is watching. He can add to the comments. You can add to the comments if you like. Correct me if I'm wrong. I believe it's the cool mist humidifiers that are typically better for you. So, and another thing with the over-the-counter cold remedies, look at the acetaminophen content. A lot of the over-the-counter cold remedies have acetaminophen in them, and you want to avoid overdosing yourself. You don't want to take more than 1,000 milligrams of acetaminophen if you're an adult, any more often than like every 4 to 6 hours. Okay, so that's all I really wanted to get to. If please put any other questions in the comments. I thank you guys so much for coming in for this information, and I hope that you please like, comment, and share this information, because it is cold and flu season, and a lot of the ERs are being overrun with people coming in for cough, body ache, sneezing, coughing, earaches, and there's really not much to do about it except to advise over-the-counter medication. And so that's why, friends, if you go in and your flu test is negative and your strep test is negative, or even if we test you for mononucleosis, like the teenagers might get the kissing disease, if all that stuff is negative, it's a good chance that it's just another one of these viruses that we don't have a test for, because there's no treatment for it. It's only symptomatic treatment. And, follow up with your primary care doctors. Of course, if things get worse or something, the ERs are always open. Urgent cares are also able to treat you for these kinds of illnesses as well. But again, I'm Dr. Khadisha, your board certified emergency medicine physician and entertainment industry mobile MD, here to help you feel better and be safe and be prepared should an emergent situation arise, or to help keep you out of the emergency room. That all of those things I'm here to help you do. So please follow me on Instagram, Facebook, and Twitter at drkadishamd.com. That's DRKADISHAMD at Facebook, on Instagram, on Twitter. And thank you so much. I hope this helps you. Have a great day. Bye.